If you're a man over 60, what I'm about to tell you might hit close to home. And I'm not saying this to scare you, I'm saying it to wake you up. Because I've seen with my own eyes how something so small, the size of a walnut, can become the center of a true nightmare in a man's life. I've met men who go years without a single night of proper sleep. They wake up 3, 4, even 5 times a night, every single night, just to rush to the bathroom. Men who stopped going for walks, stopped traveling, stopped enjoying the simple moments in life, all because they live in fear of not finding a bathroom in time. And the worst part, many of them silently accept this. They think it's normal, just part of aging. But it's not. You don't have to live like this. The truth is, there are simple habits, what you drink, what you eat, how you move, that could be damaging your prostate little by little, without you even noticing. And by the time you finally decide to seek help, sometimes it's already too late. But I've also seen the opposite. Men in their 70s, even 80s, sleeping soundly, urinating without pain, full of energy and vitality. And you know what those men did? They made changes. Small changes, but at the right time. If you're tired of having your life interrupted by your own bladder, if you feel like it's stealing your freedom, your peace, your quality of life, keep reading. Because what you're about to discover might completely change the way you take care of yourself from today on. Before we talk about the habits that harm your prostate, we need to understand what the prostate really is. No complicated terms, just a simple explanation, like a conversation between friends. The prostate is a small gland, about the size of a walnut, located just below the bladder. It wraps around the urethra, the channel through which urine leaves the body. Its function? To produce part of the seminal fluid, the one that transports and protects sperm. That alone makes it important. But here's where the problem starts. As the years go by, things begin to change. After age 50, sometimes even earlier, this gland starts to grow. That growth is called benign prostatic hyperplasia. It's not cancer, but if left unchecked, it can be extremely uncomfortable. Why? Because as it grows, it starts putting pressure on the urethra. Urinating becomes more difficult. The stream weakens, you think you're done, but there's still urine left inside. And most common of all, restless nights, with multiple trips to the bathroom. Over time, this growth can prevent the bladder from fully emptying. That opens the door to urinary tract infections, bladder stones, and in more serious cases, total urinary retention, a painful and urgent condition. I've seen men arrive at the hospital unable to urinate a single drop for hours. And the worst part is, it all happens slowly. So slowly that many only notice when the discomfort has already become part of their routine. You might even think, well, this happens to everyone who gets older, right? But no, I've seen 70-year-old men with healthy prostates, and others at 55 suffering badly. And no, it's not just genetics. It's lifestyle. It's what you eat, what you drink, whether you move or ignore your body's signals. And here's the best news of all. If habits can cause the problem, they can also help prevent it, or even improve it. Let's take a look at the 10 most common habits that might be harming your prostate, without you even realizing it. The first one of the most frequent, not drinking enough water. Sounds counterintuitive, right? A lot of people think, if I drink more, I'll spend the night in the bathroom. But drinking less water actually makes things worse. Your urine becomes concentrated, acidic, it irritates the bladder. And guess what sits right beneath the bladder? Exactly, the prostate. This more aggressive urine inflames everything around it. It increases burning, urgency, and makes you get up even more during the night. And if you take diuretics or blood pressure medication, you're already losing fluids naturally. If you don't replace them, your urinary system suffers even more. The solution is simple. Drink small sips of water throughout the day. No need to overdo it. A quick trick. Look at the color of your urine. If it's clear or light yellow, you're doing fine. If it's dark, your body is asking for water. Now let's talk about the second silent habit. Sitting for hours and hours. How many hours a day do you spend sitting? Watching TV, reading, napping, scrolling through social media. Most men over 60 spend between 7 to 9 hours a day without getting up. That may seem harmless, but it's a daily attack on your prostate. Why? Because constant sitting puts pressure on the pelvic region. It reduces blood flow to the prostate, lowers oxygen levels, and over time, promotes inflammation. And even worse, the pelvic floor muscles, which help empty the bladder, begin to weaken. The result: more difficulty urinating, more urine retained, more irritation in the prostate. You don't need to become an athlete. Just stand up every 30 to 40 minutes. Walk to the kitchen, go up and down a step, look out the window. Simple movements already make a difference. And the third habit: overusing coffee and caffeinated drinks. We know coffee is a daily ritual for many, but when there are signs of prostate issues, it can be one of the hidden villains. Caffeine is a diuretic. In other words, it makes you urinate more. But it doesn't stop there. It also stimulates the bladder, making it contract more often, even when it's not full. That leads to constant urgency, that "I need to go now" feeling. Even worse, caffeine can make it harder for the bladder to empty completely, leaving behind residual urine that increases pressure on the prostate and feeds inflammation. If you drink 3 or 4 cups a day, plus sodas or black tea, it might be time to reconsider. A simple idea: swap your second cup of coffee for a calming herbal infusion. Chamomile, peppermint, or any caffeine-free herbal tea can be powerful allies. Try it for a week and see how your body responds. If these first 3 habits have already made you stop and think, take a deep breath, because there's more to come. The key is to understand: you don't have to change everything all at once. Just pick one thing to start with, the one that makes the most sense for you, and take that step today. Now that you understand how the prostate works and how simple habits can directly affect your well-being, it's time to keep uncovering other behaviors that, without realizing it, you might be repeating day after day, and that are silently undermining your health. The fourth habit deserves special attention: eating ultra-processed foods and overusing spicy seasoning. Yes, flavorful food is delicious. A well-seasoned dish, juicy meat, a spicy kick, it's all very satisfying. But when that becomes a daily routine, the consequences eventually show up. Ultra-processed foods like sausages, canned goods, fried snacks, instant soups, frozen meals. All of them contain excessive sodium, unhealthy fats, and chemical additives that completely disrupt the body's internal balance. And when it comes to the prostate, that's even more dangerous. Why? Because these foods increase inflammation throughout the body, disrupt male hormones, and promote the growth of the gland. The result: more pressure, more discomfort, more urinary symptoms. And the spice? In small, occasional doses, it's fine. But if every meal needs hot sauce, red meat, coarse salt, and intense seasoning, you're creating an internal environment ripe for constant irritation. What can you do? Start cutting back gradually. Prioritize fresh, natural foods. Focus on vegetables, fruits, fish, and nuts. You don't have to give up the pleasure of eating. You just need to create balance. Eating well is also a form of caring for your intimate health. Now let's move on to the fifth habit, as common as it is dangerous: holding in your urine too often. It might seem harmless, but this is one of the most damaging behaviors for your urinary system. Many men ignore the urge to urinate because they're busy, feeling lazy, or thinking, "I can hold it a little longer." But every time you hold your urine for too long, your bladder overexpands. And that expansion puts direct pressure on the prostate. Over time, it causes inflammation, burning while urinating, the constant feeling of a full bladder, and more concerning, residual urine that remains and becomes a breeding ground for bacteria. The rule is simple: when you feel the urge, go. Don't postpone it. Your body is giving you a warning. Ignoring it now could cost you later. Let's move on to the sixth habit, often overlooked: smoking, or being around smokers. When people talk about cigarettes, everyone immediately thinks of the lungs or the heart. But few realize the real impact tobacco has on the prostate. Smoking reduces blood flow to all areas of the body, including the pelvic region. That means less oxygen, fewer nutrients, and weaker tissues. And it doesn't stop there. Cigarettes destroy natural antioxidants, which are essential for your body to fight inflammation and recover. That creates the perfect conditions for worsening urinary symptoms. And according to studies, it may even increase the risk of prostate cancer. And don't think this only applies to active smokers. If you live with someone who smokes daily, you're also affected. Men who quit smoking after the age of 60 often report better sleep, fewer nighttime trips to the bathroom, and more energy throughout the day. It's never too late to quit. And if you've never smoked, protect yourself from smoke exposure. Your prostate will thank you for every clean breath you take. Let's move on to the 7th habit. Avoiding routine checkups. This is a very common and dangerous mistake. Many men only go to the doctor when the discomfort becomes unbearable, when there's pain, or when their family insists. But prostate enlargement can occur silently, without any obvious symptoms in the beginning. And that's exactly where the danger lies. Because when symptoms finally hit hard, there may already be recurring infections, an overworked bladder, or even risk of kidney damage. A simple exam, done once a year, can detect changes before they become serious problems. Often, no medication is even needed. Lifestyle changes, when made early enough, can be more effective than any treatment. Avoiding exams out of fear or shame means giving up on prevention. And believe me, taking care of your health is a sign of strength, not weakness. Now for the 8th habit. Consuming too much red meat and processed meats. No one is saying you have to cut meat from your diet. But eating red meat every day, especially processed types like bacon, sausage, ham, salami, is a daily invitation to inflammation. These foods are packed with saturated fats, additives, and chemical preservatives that directly affect male hormones. On top of that, they slow digestion, cause bloating, gas, and constipation, all of which increase pressure on the prostate. Studies show that men who eat a lot of processed meats have more urinary symptoms, including pain and urgency. The solution: cut back. You don't have to eliminate them completely. 3 times a week is enough. And when you do eat meat, go for healthier preparations, roasted, boiled, or grilled. On the other days, opt for lighter, more nutritious options like fish, eggs, legumes, and vegetables. Your digestion will thank you. Your energy will improve. And your prostate will benefit too. And now, let's talk about a sensitive, but extremely important, topic. Excess belly fat. It may be uncomfortable to hear this, but it's necessary. The fat that accumulates around the belly isn't just a cosmetic issue. It's a clear sign of chronic inflammation inside the body. Men with a waist circumference over 100 centimeters, about 39 inches, are at higher risk for prostate symptoms, erectile dysfunction, and restless nights due to frequent urination. In addition, excess weight disrupts hormone balance. Testosterone drops, estrogen rises, which also contributes to prostate enlargement. But here's the good news. Losing just 3 to 5 kilograms, around 7 to 11 pounds, already makes a difference. No need for extreme diets. Just small changes. Cut back on sugar, avoid soft drinks, reduce refined flours, walk every day, sleep better. And more, that belly fat physically presses against the bladder, which worsens urinary symptoms. Losing weight helps free your body, inside and out. And to close this section, ignoring chronic stress. This is the invisible habit that eats away at men's health the most. When you live under constant stress, your body increases production of cortisol, the stress hormone. And that excess leads to inflammation, hormonal imbalance, and tightness in the pelvic muscles. The result: more pressure on the prostate, more difficulty urinating, lower energy, and worse quality of life. Taking care of your mind is also taking care of your prostate. And sometimes, all you need is 10 minutes of silence. Breathe deeply, listen to calming music, take a slow walk, or talk to someone you trust. I've seen men transform their health just by learning how to relax. And you can too. Now that you know the 10 most dangerous habits for your prostate health, you might be wondering where to start. And it's completely normal to feel overwhelmed by so much information. But the truth is, all it takes is a single decision to begin real change. And to show you that it's possible, I want to share 3 stories with you. 3 men. 3 completely different realities. But with one thing in common, they all decided to take the first step. Let's start with Ernesto, 74 years old, retired. He came in exhausted. No light in his eyes. He said he was waking up 6 times a night to urinate, and that it had been going on for years. The broken sleep left him irritable, drained, and his relationship with his wife was suffering. When we talked about his routine, everything made sense. Very little water. Strong coffee late in the afternoon. Hours and hours sitting in front of the TV. Lots of processed meats. No walking. The plan was simple. Drink small amounts of water throughout the day, but stop by 6 p.m. Replace the coffee with a calming herbal tea. Stand up every half hour, even if it's just to walk to the window. Take a 15-minute walk after lunch. Replace processed meats with fruits and nuts. 3 weeks later, he came back a different person. Lighter. Smiling. He said, "It's been 5 nights now, I only get up once. I slept like I haven't in years." His wife added, "He's laughing again. He wants to live again." And sometimes, that's worth more than any prescription. Now I want to tell you about Manuel, 68 years old. A former truck driver, he was always afraid of doctors. He believed that if it didn't hurt, there was nothing to worry about. But after attending a lecture, he found the courage to speak up. "I think something's wrong with me, but I'm afraid to find out." The signs were already there. Weak stream, feeling of a full bladder, urgency at night. We did some simple tests. The diagnosis? A slightly enlarged prostate. Nothing serious. But the time to act was now. We changed his diet. Less red meat, more vegetables, fish, and whole grains. He started doing morning stretches. Going to bed earlier. But the most important change wasn't physical. It was emotional. Manuel confessed that ever since he retired, he felt useless. He kept everything to himself. Held in his anxiety in silence. But just by opening up, something shifted in him. 2 months later, he was a different man. Calmer. More present. More alive. He said, "I didn't know that taking care of the prostate also meant taking care of the mind." And finally, Julian, 80 years old. Unlike the others, he never had symptoms. He always accompanied his wife to her appointments, always smiling, walking upright and confident. One day, curious, I asked him, "You've never had urinary problems?" He laughed. "No. But I care for my body like I care for my garden." His routine was simple but powerful. A glass of water first thing in the morning. Daily walks. No coffee in the afternoon. A light, varied, natural diet. Classical music in the evening. A good laugh every day, even if it was just by himself. And one phrase stuck with me: "If I water my garden and care for it with love, it blooms." The prostate is part of that garden. These 3 men show us that there is no right age to start taking care of yourself. That you don't need perfection, just consistency. And that waiting for a problem to show up before taking action can come at a high cost. Maybe you're like Ernesto, tired, frustrated, unsure where to begin. Or like Manuel, full of doubts, but willing to try. Or maybe you're doing well, like Julian, and want to stay that way for years to come. Wherever you are on this journey, what matters most is, you're here. You've already taken the first step. You listened. You reflected. You opened yourself to something new. And that, in itself, is an act of courage. Now you might be thinking, "Okay, but what do I do with all this?" The answer is simpler than you think. Start with just one thing. One change. The easiest one for you. Maybe it's drinking more water during the day. Or cutting out your afternoon coffee. Or taking a 10-minute walk after lunch. Maybe it's stopping the habit of holding in your urine. Or finally scheduling that checkup you've been postponing. It could even be sitting quietly for 10 minutes and breathing. It doesn't need to be drastic. It just needs to be real. The prostate, though small, has a huge impact on your energy, your sleep, your mood, your intimate life. And it responds to your care. Always. I've seen men over 80 change their habits and reclaim their quality of life. Because the body responds. It always responds. It just needs to be heard. So now, ask yourself honestly, Which of these habits will you change first? Write it in the comments. Just by writing it down, you're already committing to your health. And if this message touched you, share it with someone who needs to hear it too. Maybe your brother, your father, a friend. Sometimes, one conversation like this can change everything. Living with more peace, better sleep, more vitality. It's possible. And it all begins with a single decision. Just one. Thank you for staying with me until the end. Take care of your prostate, and it will take care of you.